the initial phase of your preparation. But the sooner you start organizing your counseling, the better you will be by the end of your preparation time. So near the exam, whatever topic comes, you will know how to deal with it. Now,
Yeah.
first of all, there are certain topics like GERD or MI counseling or counseling about preeclampsia. These are some of the topics which are very, very common topics. Every day we see them in family practice, family medicine practice. So
Mm.
when these topics come, they actually need a lot of attention, and a lot of what I would say that the way you will interact with the patient, you will be highly tested on that. The reason is because the entire Canada will be scoring a lot of marks on these topics, because it's an easy topic, it's not a difficult one. So if your counseling is a little bit, more like there are various types of counseling. One counseling is that you give everything in like a one long lecture or speech, and the other way is a conversational counseling. Uh, Personally, I feel that conversational counseling is more effective to the examiners because they give you more marks. And what is that counseling in which you make the patient speak more? Now, the same information that you are giving, let the patient talk to you rather than you giving that information. Now, how are you going to do that? So, for example, first of all, let's start with the first thing. When you did the explanation of the condition that it is called GERD, and have you ever heard about it? So that was a very good thing. You have to check back with the patient that have you ever heard about it? Do you know about it? So that is called checking back. The next thing is that in counseling, you cannot use jargons. What are jargons? The medical terminologies. So instead of using esophagus, you can use food pipe. Okay, you can tell the patient that we have a food pipe, and because if you use jargons, you will not just lose marks, but overall the impression would be, or the patient might say, "Oh, what is that? I don't know." So medical terminologies are a no. The other thing is instead of saying sphincter, you can say a valve
Yeah.
or a gateway. Yeah, that would be an easier term for them to understand. So when you explained the pathophysiology very nicely that there's a food pipe and sometimes it get loose or it doesn't close properly and the acid comes back into the food pipe, and that's why you are having this chest pain. Now, after that, when you come to the management part, so first of all, you'll tell the patient when you start your counseling that, okay, whatever the name of the patient, let's suppose it's James. So, James, thank you for sharing all the information with me. So, from whatever we have discussed so far, I feel that the pain that you're having right now is related more to your stomach rather than to your heart. But just to put you on ease, because you are smoking, you're 40 years old and you have been smoking for a long time, the risk factor is there. I will be doing an ECG for you today just to
Okay.
put you at ease and make sure that everything is fine. But regardless of the fact, I feel that, this is more related to your stomach. And then you explain the pathophysiology. And then the next part, you will come to the management. So you tell him that, okay, James, the condition that you are having right now, we have the good part is that it is very much a manageable and treatable condition. There are two ways of managing it. One is the lifestyle modification, and the other is the medical treatment that we have on board. Lifestyle treatment will help you for with the initial settlement of this problem. So, can you walk me through a day in your life and tell me how does that day looks like? Okay, so then let James talk. Let him tell you that, okay, doctor, I wake up in the morning, I take a cup of coffee, maybe I eat late at night, I eat spicy food. So when he's talking to you, then talk to him. So James, as you mentioned that, taking this cup of coffee is triggering your factors. So there are other reasons as well that can cause this GERD, trigger this disease. They are like, weight gain. So have you